Public health leaders have played a critical role in the design and implementation of drug donation programs. I was wondering if you could talk a bit about some of the public health benefits that you see from drug donation programs.
So public health is what we do collectively as a society to assure conditions in which people can be healthy. And that's what this program and all the programs through SafeNetRx do, assure those conditions for Iowans to be healthy.
One of the things that makes Iowa's drug donation program unique is that we provide medications that cover the full spectrum of disease states.
Yeah, I think probably one of the areas where we have the greatest impact in our state is in the area of chronic disease. So 3 out of every 4 healthcare dollars are spent on chronic diseases. And some of our top public health concerns are, we have sort of a top 10 list, and at least 3 of those diseases are chronic diseases that I know you directly impact through your programs, and those are cancer and diabetes and mental health. Certainly some of those medications are particularly expensive, and they pose barriers for Iowans to be able to access the needed medications, and this program helps. In speaking with Polk County Health Department, which is one of our member organizations, I learned about the tuberculosis program that they run, as do other public health departments around the state. And I think it's such a win-win, the way that they take advantage of your program. So they treat, on average, anywhere between 340 and 400 patients each month who have either active tuberculosis or latent TB. And those are about 400 visits, either in the health department or in people's homes. And as part of that course of treatment, those patients need to have 9 months of medication within a 12-month period. When patients aren't able to complete their medication course, then that's a waste of the medication if it can't be recycled and reused through your program. The patient who receives a successful course of treatment, we think of that person as the beneficiary of the program, the drug depository program. But also I think we need to think that's an example where it's a chronic disease, but it's also an acute infectious disease. And by successfully treating that community member, we're protecting the rest of the community from spread of that disease.
Medication waste is a growing public health issue.
The nation, as well as the state, is very focused on Iowa's water quality. However, there are other emerging public health issues with our water, and contaminants ranging from cyanobacteria, microcystin, and arsenic, but also pharmaceuticals. And that's definitely getting some attention from the healthcare community as well in terms of what's our contribution to that problem. And so a program like this where we can recycle medications and keep them out of our water is important. And also it lowers the barrier for the healthcare system in general, because they're accountable for what they're doing with those medications. And if they either incur the cost to have them disposed of properly, or in some cases we know they're disposing them into the water supply directly, and so that's problematic from a public health perspective. Much of what we get done in this state comes when neighbors come together to help each other, and public health is the perfect arena for that to happen. And when I first learned that the programs that are run through SafeNetRx are unique to Iowa and that this kind of collaboration isn't already present in other states, I was surprised. And then upon reflection, not that surprised, because I imagine that it's a result of people coming together collectively to address a need. And that's what we do really well in this state.
We have thought that Iowa is a wonderful laboratory for designing innovative programs, because we have such wonderful access to elected officials and state agency leadership and association leadership that Iowa really is uniquely positioned to help grow and develop programs such as this.
For sure. I think I attended a stakeholder meeting that you hosted recently, and when there were people there from other states, they say it would be a coup just to get that diverse a group of people and organizations in the same room together to even talk about an issue. And we were there to fine-tune an issue and continue to support a solution that's already been put in place by the state.
The unique thing about the drug donation program is that there's so many different stakeholders that benefit from the model. Long-term care, healthcare providers, they benefit from donating medications and the financial savings of not having to pay to incinerate medications. Certainly, it's the patient that we truly want to impact in a positive way. When the patient benefits, so does the healthcare system, and ultimately, taxpayers and individuals living in our communities. So it's really been a win-win for many stakeholders. We'd like to thank you for the important role that the Iowa Public Health Association plays, because we have been working to engage more public health partners in our programs.
Well, that's what we do. So as a professional organization, I often say we connect and convene, and that sounds trite, but it's true. That's really what we do. And I think there's some creativity to the work that we do, and it's in making connections between the seemingly unconnected. And that's what we're able to bring to this. It's your good work that's being conducted around the state, and we get to be the voice to help amplify that and bring additional stakeholders to benefit that work. And that's our privilege.